Welcome to this educational program. This module discusses bedwetting, also called primary nocturnal enuresis. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Bedwetting, or nocturnal enuresis, is a common condition that can cause a child embarrassment or even withdrawal from social activities. A thorough understanding of this common condition can lessen the fears that both a child and his or her parents may have. Nocturnal enuresis is the medical term for nighttime bedwetting. Primary nocturnal enuresis implies that the condition has always been present, while secondary enuresis describes cases where the child did achieve consistent dry nights, then began wetting again. Everyone starts life as an infant who makes and releases urine around the clock. Gradually, we grow and eventually learn to urinate only during waking hours. The time it takes to reach this stage is different for everyone, although for most it stops by age 5 or 6. At age 5, about 15% of children wet the bed, and every year from then until age 15, another 15 of every 100 bedwetters get dry. At age 15, only about 1 or 2% of kids are still wetting the bed. It is helpful for children to understand that in a school classroom of 25 to 30 kids in kindergarten or grade 1, about 4 of them will be bedwetters. And even in the 4th grade, there will still be a couple children who are still wetting the bed. While bedwetting can be a frustrating occurrence, it is important to remember that the child does not do this on purpose. Enuresis is not a mental disorder or behavioral problem. It does not mean the child is lazy or trying to irritate their parents. And it does not mean that the parents have done anything wrong. So what causes enuresis? Babies make urine around the clock. During childhood, most individuals gradually make the transition to only urinating during the waking hours. However, this takes longer for some than others, due to several factors. While we don't yet understand all the causes of bedwetting, we do know that there are several issues that can contribute. For instance, the child's bladder might just not be big enough yet to hold all the urine that is produced during the night. Sometimes, the child produces more urine than their bladder can hold, and oftentimes the child is a deep sleeper. There is also a familial link to bedwetting in some, and scientists have discovered a gene associated with bedwetting. If only one parent wet the bed as a child, his or her child has a 25% chance of being a bedwetter, and if both parents were, then the child has up to a 65% chance. Sometimes, of course, a child wets the bed even if neither parent did when they were children. Some of the more rare causes of enuresis include hormonal factors, physical abnormalities, infection, and nerve disorders. Some children may not produce enough of a hormone called antidiuretic hormone, or ADH. This hormone reduces the amount of urine produced by the kidneys. An infection, nerve disorder, or diabetes may also be the cause. If your child is 5 or under, the best thing to do is be patient and understanding. It is most likely that your child just needs more time for his or her bladder to grow and sense of bladder fullness to develop. If your child appears to be uncomfortable while urinating, however, you should take him to see your doctor for a checkup. It may be helpful also to have your child limit bedtime liquids, especially those with caffeine like colas or tea, as these can increase urine production. Remember to have your child use the toilet before going to bed. Also, don't forget to put a rubber or plastic liner between the sheets and mattress to protect the bed. If your child does wet the bed, or wets absorbent underpants, make sure you and your child wash any skin that has been in contact with urine well. This will help prevent a rash from developing. Try not to be critical of your child, and make sure no one else in the family is critical or teasing. Your child needs your support and encouragement. Do not pressure him or her to develop nighttime bladder control before their body is able to do so. This could cause even more frustration for the child. Many children are embarrassed by their bedwetting and are afraid their friends will find out. This particularly becomes an issue when children want to have sleepovers or go camping. At this time, they may become motivated enough to begin accepting some responsibility for managing their bedwetting and to try some behavioral adjustments. These can speed the development of normal bladder conditioning. Behavioral therapies include wetting alarms, helping with changing of the bed sheets, daytime bladder training, and positive reinforcement. In the meantime, keep reminding your child that bedwetting is not their fault and that they will outgrow it as their body develops. Your child's doctor may also have other helpful suggestions. As always, continue to enforce the no teasing rule at home. Wetting alarms function to recondition a child's brain to be more aware of his bladder filling and to wake him in time to urinate voluntarily. These devices sense urine and sound an alarm when they become wet. This wakes the child, who can then go to the bathroom to finish urinating. It must be reset when the child returns to bed. Alarms tend to be most useful when children are starting to have some dry nights on their own. Encourage your child to change wet sheets and blankets. This is not meant to be punishment, but to foster responsibility. It's a good idea if other siblings are also required to change their sheets regularly. Bladder training may also help. This method encourages children to gradually increase the time between daytime urination, allowing the bladder to slowly stretch and to hold more urine at a time. Bladder training simply involves regular urination, in other words, every 2 to 3 hours, in order to promote adequate filling and emptying of the bladder. Like other behavioral therapies, bladder training requires patience and motivation, and results may not be seen for several weeks or even months. It is important to praise positive behavior and to avoid punishing or teasing when slip-ups do occur and your child has a wet night. Rewards, such as a star chart, can be helpful in encouraging a child to continue working towards dryness. With this, a star or other sticker is given to the child on mornings after a dry night, and he or she can post these onto a calendar, which is kept in a public place, such as the kitchen fridge. If your child is older than 7 and wets the bed more than 2 or 3 times a week, talk to your child's doctor. The doctor will examine your child and will ask you several questions about his or her urinary habits, like how often he or she urinates and at what times of day, and whether or not any difficulties are apparent during urination. A family history of enuresis, types and amounts of beverages consumed by the child, and changes in the home environment will also likely be discussed. A urine test or urinalysis may be done to rule out an infection of the urinary tract. Finally, if your doctor suspects a physical problem, testing may be conducted, including an X-ray or ultrasound, to determine if there are any abnormalities of the kidneys or bladder. Having said all of this, be encouraged that physical abnormalities and infection are only very rare causes of bedwetting. There are medicines available that can help in certain situations. It is important to understand, however, that while these can help control the situation until the child outgrows it, they do not alter the underlying problem and will not affect the natural course of events. It is therefore important to continue the other efforts we have already discussed. Keep in mind also that medications may not always work. Enuresis can resume after stopping the medication, and they can have side effects. For all of these reasons, it is imperative that you discuss this issue carefully with your doctor before making a decision to try medication. There are 2 general kinds of medications used for enuresis. One kind slows down the production of urine, and the other relaxes the bladder so that it holds more urine. Desmopressin, also known as antidiuretic hormone, ADH, or DDAVP, is available as a pill or a nasal spray, with the pill being preferred. This medication slows urine production at night to reduce the chance of filling the bladder and wetting the bed. Desmopressin may be used regularly or for situations when a little more security is required, such as during sleepovers or campouts. Possible side effects may include upset stomach, headache, stuffy or runny nose, reddening of the skin, and stomach cramps. Please talk to your doctor and pharmacist to learn more about these medications and read the prescription insert for more detailed information. A second type of medication sometimes used is a class of drugs that relax the bladder muscle. These are known as antimuscarinics or anticholinergics. These are also available as a pill or a liquid. These medicines can also be used regularly or in certain situations only, and they may also be used in combination with desmopressin. Side effects can include dry mouth, dry eyes, and constipation, among others. Again, please consult with your doctor and pharmacist for more information about these medications. Bedwetting is common, and it is considered a normal part of growing up, especially by those age 5 and under. Normal, healthy children may wet the bed. As a child gets older and his or her bladder grows, the frequency of bedwetting goes down. There are some techniques that can help your child gain responsibility for managing bedwetting, like using an alarm, changing the sheets, and bladder training. Letting your child's doctor be a partner in helping to manage bedwetting will also help you and your child better understand the causes and treatments of enuresis, and empower you to make a positive difference. Always remember that bedwetting is not your child's fault, and it is not your fault. Be patient and understanding, and encourage your child to do the same. These resources may help you find further information about bedwetting. We sincerely hope that this module has furthered your understanding of bedwetting. We wish you the best for the future, and thank you once again for viewing this educational program.